Hi, and welcome to Healthy Living. We are here today with Dr. John Kelemen. Thank you so much for joining us. You're a cardiothoracic surgeon, and I'm thrilled to actually ground you and talk to you. So many questions. The first thing, I know you're like, oh, what? The first thing I'd like to ask and talk about is a little bit about your history. Where are you from and your family?
Well, I grew up in the Washington, D.C. area and went to college in Maine at Colby College, and then came back to the D.C. area and went to the Uniformed Services Medical School. And that took me on a long career through the military to a lot of places. And then ultimately I went into private practice after that and was practicing in Ohio.
Okay.
And recently came down here.
Why the Low Country for you all?
Well, we've been coming down here since I was in college. My wife's parents have always had a house down here, and so my kids have kind of grown up going to the beach and so forth. And so the opportunity to move down here to a place we've always visited was fantastic.
It was kind of fun as we were talking, preparing and getting ready. You have 5 kids, and you're almost empty nesters now.
Yes, my youngest is sophomore in college at Bucknell.
It's kind of fun and exciting too. So what do you do for fun?
Since I got here, more and more.
This is good. That's why
Yeah.
you're here, right?
I've always loved golf, so I play golf. But since I moved down here, I'm learning to play pickleball.
Good for you. And hey, that is the sport for down here, isn't it?
Yeah.
You know, it's interesting to talk about quality of life when you're down here, and that brings us to what I'd like to know about cardiac thoracic surgery. I'd like to know a little bit about what you do.
So we take care of basically adult cardiac problems. So there's 2 primary operations or 2 areas of problem. One is blockages in the coronary arteries, which are the blood vessels which supply the heart.
Okay.
And the other is valve surgery. So the valves that make blood flow in one direction through the heart.
Dr. Kelemen, how do I know if I have or need surgery? How do I get to you as a patient? If I'm a brand new patient, okay, am I referred to you? Am I having symptoms?
So generally, yes, you are having symptoms. Common symptoms are shortness of breath, chest pain, pain radiating to the left arm,
Okay.
things like that, dizziness. But you usually go through a cardiologist, which is a medical doctor who manages heart problems and does heart casts, and or the emergency department or a primary care physician.
Are most of your surgeries emergent? Are they planned? How does all that work?
Well, it's probably about a 50-50 split.
Oh, is it really? Okay.
A lot of people have a heart attack or close to a heart attack, come to the emergency department, and that's when they realize they have a big problem. And then probably about the other half of people have some symptoms that are less severe, and we get it figured out.
Can you share with me a little bit about how your practice works? And again, if I come in as a new patient, take me through really what I'll be experiencing, because I know you've got a wonderfully collaborative team that you work with.
Yes, so that's correct. We have a team that involves physician assistants, dedicated nurses, and myself. And so our PAs, and which means physician assistant, and our nurses will see you through the entire process. So they'll meet you when you come in, when we get consulted. They'll participate in your evaluation, in the operation, in the inpatient care, and ultimately in the outpatient care during the recovery phase.
What are the biggest challenges I think that patients have when they come in? Is it just fear, apprehension? They don't really know, they don't have or know what to expect? All of the above?
Yeah, I think all of the above. I mean, you know, a lot of people are going along thinking they're doing fine, and all of a sudden they discover they have a life-threatening illness and need major surgery, and so that can be kind of scary.
How does the group break down? In other words, will the physician's assistants, what is their actual role versus the nurse?
So the nurses, we have a nursing clinic, Micah, and she coordinates a lot of things that happen.
Okay.
And then in the hospital, the nurse...
So she's going to take me through my process.
Exactly.
Okay.
Exactly.
Thank
So
you.
she'll do that. The nurses in the hospital provide direct care at the bedside. So in the intensive care unit and in the telemetry unit.
So this is a question I think a lot of people have now. When I think of any kind of heart disease or surgery, I think of long stays in the hospital. Once the surgery is completed, what does that typically look like? And I know we talked about this, there's no typical.
Well, I would say most people are home in 5 to 7 days.
Are they really?
Yeah, and at that time they're able to perform their normal activities of daily living.
Okay.
So not heavy lifting, no wood chopping, things like that.
No wood chopping, yes.
But that's the norm. Older people in their 80s or 90s may go to rehab for a while just to get their strength back and have a little help.
So how long of a relationship will I typically have with you as the surgeon? Then do I come back a week after, a month after, 6 months after, a year after? How does all that work? So
we usually have a clinic visit 2 weeks following discharge from the hospital, but we're in phone contact during that whole time. So routinely, our clinic nurse, Micah, will give you a call 2 days after you go home to check on things, make sure they're going okay. We're coordinating with your primary care doctor and your cardiologist, so we're coordinating with your other doctors as well as making sure things are going well with you and talking to your spouse to make sure they agree.
Dr. Kelemen, the one thing I feel really confident with after talking with you is that I can be assured that the caliber and quality of my care from the time I walk in till I walk out is extremely professional, and the continuum is pretty amazing. How does that work?
Good question. So we have our team so that I'm always getting the information, and if I'm busy doing an operation, there's still someone available. So Micah in our clinic will be available to take phone calls, to call people, to get things scheduled. And both of our PAs, Sean and Tim, are available to see in person if I'm operating, or to answer calls and facilitate getting information, and ultimately you to see me.
So really that goes from the second you walk into the office through your experience within the hospital. Are your team members at both?
Yes. So they're both in the clinic, in the hospital, and on call at night. So we have both myself and at least one PA available 24/7.
I mean, I would think that would make me as a patient feel much more comfortable and confident. Well, actually as a patient or a family member too, knowing that I could reach out if I had any unexpected questions or just needed reassurance that everything was the way it was supposed to be.
Exactly.
I really appreciate you taking time to come and talk to us. It's really informative, and again, I think, you know, managing our expectations, being real and demystifying the process is pretty impressive. Thank you. We are joined now by Micah. Thank you for joining us. We've heard wonderful things from Dr. Kelemen and the rest of your team, and excited to talk to you for a few minutes and get firsthand information, a little bit about you, and then what you do here.
Yes, absolutely. So I'm originally from Myrtle Beach and just recently moved to the area in the last 1.5 to 2 years. I've been working for Dr. Kelemen about 6 months now, and it's definitely a different but challenging job.
You're married?
I am.
And your husband's a Marine, you said?
He is.
I love it. Talk to me a little bit about what your role is here with Dr. Kelemen.
Yes, so I do a little bit of everything. I schedule patients, I set up referrals, I see them in the office. I usually follow them during surgery and after surgery, and then I'll get them set up for follow-up appointments. But I think the biggest thing is being a patient advocate during that time, making the patient feel comfortable, knowing that they have someone to go to when they have questions. I think that's a really big role that I have.
I know that as a potential patient, I think it's something that there would be a lot of fear and anticipation about.
There is, absolutely. And I feel like that's where I can kind of come in and make them more comfortable.
And what does that look like? Would I be able to just contact you, answer questions?
Yes, so I'm pretty open Monday through Friday. They have the option, and then of course if I'm not here, someone's always on call. But you know, I let them know, like, it doesn't matter how many times you have to call me. Like, I will be here to answer any questions that you have, because I imagine myself in that situation, and I would want someone to be there for me and make me feel like, you know,
comfortable.
Yes, exactly.
And that they were with professionals.
Exactly.
You've got a pretty impressive team. Talk to me about the office team.
Yes, so we have our office supervisor, Kalinka. She's awesome. She kind of makes the world go round, as Dr. Kelemen says. We have Tim and Sean, our PAs, and then there's me. So it's a small team, but we're very powerful together.
Exactly.
We make a good team.
That's pretty impressive. Thank you, thank you. It's really fun to talk with you.
Yeah, thank you. Thank you for having me.